Good morning, Amy here at MilfordMD. Today we are going to do a little tidbit about our HydraFacial MD with our beautiful patient. For those who don't know what a HydraFacial is, boy, you are missing out. HydraFacial MD is essentially a medical grade facial. Most people get facials at a spa where they put warm towels on you, blow some steam in your face, and yeah, sure, it's relaxing and you feel great that day. Tomorrow, when it gets down to it, it's back to the same old, same old. There's no real change in the skin. HydraFacial is different in the respect that it uses a patented Vortex technology that infuses active ingredients into the skin. So not only do you get the instant gratification of seeing an actual change in the skin instantaneously, but it continuously gets better as far as texture, pores, any acneic things, plumping of the skin, and hydration for 3 to 4 weeks. We are going to start our treatment. The patient has cleansed her face. Essentially, to HydraFacial, there are 4 key steps as far as the process. The very first part, which I will demonstrate in a moment, is your manual exfoliation. It combines lactic acid and glucosamine on the skin. Doesn't cause any kind of sensations on the skin physically as far as what the patient is feeling. It's just normally wet. What that lactic acid and glucosamine is it starts loosening all the dead skin cells, softening blackheads, sebum, opening up all the pores so that the skin is able to accept all of the ingredients we have today. Step 2 is a chemical peel. Very mild. We do have 3 different strengths that we can work up to. You get all the good benefits of a chemical peel with no side effects. Most people have hesitations as far as downtime with redness, peeling, all of that. With HydraFacial, with the Vortex technology, it pushes and pulls at the same time, so you get the benefits without any of the nasty, unwanted side effects. Step 3 is your extractions. What that is it's normally focused just in the T-zone area where people have issues as far as clogged pores and congestion. It's salicylic acid and honey. Typically with salicylic acid, when it's on the skin by itself, it's very temperature hot and can cause a stinging, tingling sensation. With this formulation from HydraFacial MD, there is none of that. It's actually very soothing to the chemical peel itself. And then the very last step is your tall glass of water. It combines hyaluronic acid, antioxidants, and peptides. It helps fight free radicals, helps keep the skin nice and hydrated, and it does plump up fine lines and wrinkles. As far as HydraFacial itself, it's great for any skin type. It helps with anti-aging, anybody that's looking for a nice natural glow. It helps clean up acneic skin. So there's not really any stipulations as far as who it's good for, who it's not good for. Both male and female can definitely benefit from it. So we'll start with our manual exfoliation here. How you doing? Any discomfort?
None at all.
Perfect. So here we are at step 2 with our chemical peel. This is a 7.5 glycolic, 2% salicylic. What that's going to do, it's going to further keep exfoliating. It's going to start flushing out the pores. It does start moving all of the dead skin cells and sebum around. HydraFacial has different tips for different types of penetration. This is the chemical peel. Normally, as applying it, you can see that the skin does get slightly pink. That means it's reacting to the peel. As far as the patient, do you feel anything yet?
Not at all.
Which is good. Just because they're not feeling anything doesn't mean it's not working. Typically with the chemical peels, people feel an itchy sensation, sometimes an overall tightness in the face, but it does get better after we do neutralize it after a couple steps. But as you can see, there is pinkening going on, so she will definitely be benefiting from this. We do have 2 stronger peels that we can upgrade to once you start tolerating this one well. Here we are at step 3. This is the extraction portion. We did change the vacuum control. We did up it a little bit. This is normal parameters. Most patients tolerate it well. Essentially, this is the salicylic acid and honey. We have left the chemical peel on the face because we want it to still keep working. So now we're just going to work on her T-zone here, flushing out these pores. It gets any blackheads, any sebum, any dead skin cells that are on the skin itself. You could potentially, if you had a problematic area more towards the cheek, or if you broke out on the cheek specifically, we could focus a little bit more energies in there. This client, however, has pretty good conditioned skin, so we're just going to do the basic around the T-zone, make sure that we keep her from getting any type of breakouts in the future. So just to reiterate, this is the salicylic acid and honey. Should be quite comfortable to the patient now.
Yes.
Just feels wet most of the time. Okay, and before we start our fourth step of a signature HydraFacial, I just wanted to briefly touch on the specialty serums that we do have available. HydraFacial MD is great at being super customizable for any skin type, young and old, anti-aging, acneic. I have a lot of clients that are teenagers that have their moms and dads bring them in, and we've been working on a process of, cutting back on the breakouts, because let's face it, high school is hard enough by itself. So we do have a multitude of different serums that we can mix and intertwine to help both plump up the skin for big events like weddings and family get-togethers, high school reunions, all of that. We have one that's great post any other treatment like lasers, that's essentially going to help the skin repair itself that much faster following those procedures. We do have a HydraFacial that's specifically for acneic skin that does include a blue LED light that helps kill any bacteria on the face that cause the acne. And then with all of the other specialties, serums, our anti-aging HydraFacial, our regenerative HydraFacial, they come with a red LED light treatment. What the red light does is it helps penetrate the serums into the skin deeper, making it last longer. It also stimulates local circulation to help simmer down any redness that we did instigate with the chemical peels or just the actual motion of the HydraFacial itself. And the red light has anti-aging properties to help with fine lines and wrinkles. But the very last part we're going to do here is your tall glass of water. This is your antioxidants, peptides, and hyaluronic acids. Most people, it's very wet, but you can see that people, as we move around her face, they will absorb this material very quickly. The other thing is that the skin will only take what it wants, so we do use this one liberally all over the place to make sure that we're getting the best possible outcome. It is cold season. People do have lots of dry skin coming from the cold outside to the indoor heat. So HydraFacial is great for now. It's great for the summer with all the oily skin and sunscreens and all that. Okay, and we're just going to do a demonstration of our red LED lights. If you look, you can see there's like a glistening wetness to the skin. I'm going to start placing this around her face, and it'll be a great demonstration of how it helps the serums be absorbed much better. It does help with rosacea as well, as far as red lighting therapy. It's not a hot or cold light. It does feel very nice on the skin, does it not?
It does.
It's very soothing. And like I said, the benefits of having your serums be penetrated in deeper, making it last longer, is always better for the patient, because you want to make sure that you're seeing results with something. And if you can help with acne, or if you can help with dryness or anti-aging, or just giving somebody that, better texture to apply their makeup if they want, is always super helpful.